Hello and welcome to The Virus. I'm Jeremy Fernandez. Federal and state governments have spent billions of dollars on COVID-related health and economic measures. So where has it all gone? How much more will we need in this crisis? Coming up, we'll take a look at what's needed as we move into the next phase of the pandemic. But first, let's bring in Casey Briggs. Casey, more restrictions have eased in parts of the country this week. What's happening with the number of people being infected?
Yeah, hi Jess. I think as we've been talking about for a couple of weeks now, we're looking at this second Omicron wave in Australia has, clearly sort of peaked now, but the descent is very slow. We're still seeing more than 40,000 cases a day as our sort of average at the moment, and declining very slowly. If you look across the states and territories to get a bit of a view of how much virus there seems to be in different places, well, it looks like Western Australia has the most virus about at the moment. It's at least reporting the most cases per capita of all the states and territories, and the fewest cases at the moment being found in Queensland. WA sort of was improving, and that kind of improvement in its case curve has really slowed down in the last couple of weeks. That's why it's in that position. And then when we look in terms of the numbers of people dying, well, we've got some not great news really there in Australia, because since last week we've seen that grow from about 28 deaths a day on average to just under 36 deaths a day is what we're looking at the moment. So that's a pretty significant lift in just 1 week. And Jeremy, there's just probably two things I just want to draw your attention to when it comes to the deaths in Australia. One of them is how many are occurring at the moment in aged care. This chart shows you the weekly deaths reported among residents of aged care dating back to midway through last year. That's obviously the big Omicron wave at the start of this year. What we're seeing at the moment is it does look like those numbers are increasing again in aged care. 72 deaths were reported in the week ending the 21st of April. That's about, well, it's a bit over a third of all of Australia's deaths in that same period. So a third of all of Australia's deaths look like they're happening at the moment in aged care. And just another thing on deaths in general, as we're watching them climb, they are, worldwide relatively low numbers, but one of the countries we've looked at a lot through the last couple of years as doing a not particularly good job, having very high numbers of deaths, is the United States. And they've just recently been seeing those numbers really starting to fall in terms of deaths quite dramatically. And believe it or not, Jeremy, Australia at the moment for about a week now has actually been recording more deaths a day per capita than the United States. So that kind of puts into context just how much of an improvement the United States has had. I think, you can't forget that with this blue line for Australia has been well below the US line for the entire pandemic until this week. Believe it or not, that's the situation we're in right now.
Casey Briggs, thank you. So Joe Biden's chief medical advisor, Dr. Anthony Fauci, issued a warning this week that the pandemic is not over. Instead, we're experiencing different phases of it. So what are the impacts on our health system in those various stages? Dr. Chris Moy is the Vice President of the Australian Medical Association, and he joins us now. Dr. Moy, thanks for joining us. We're clearly in a different phase of the pandemic. We seem to have settled into a more controlled environment. Have we learned enough to now say that those days of the explosive case numbers are now over for good?
Look, although we'd like to think that it's all over, I don't think COVID really is going anywhere. And despite the fact that the vaccines have done an amazing job to avert sort of the potential scenes of disaster like we had in Italy, where we had mass deaths and we had, overloaded hospitals, we are not seeing a thing called herd immunity, which we had hoped. We are still seeing significant reinfection, and we are still seeing a situation where we have the threat of new variants coming in being more infectious. And so I think the thing to keep in mind is we're not talking about a cold. We are still talking about a multi-system disorder, which is still going to cause a major threat, particularly with those who are immunosuppressed or who are unvaccinated, but also leave a lasting and ongoing legacy of long COVID. So we're seeing somewhere between 3 and 12% with long COVID, which also has another little aspect to it of potential increases of things like strokes and heart attacks and potential, brain effects like earlier dementia because of what we're seeing, the effects on the brain. So these are things that are going to continue on and be additive to what we already have in terms of a health system that is really already overstretched, needing to provide care for.
So this is an interesting thing during this election campaign, because we've returned to this debate in this election campaign about notions of debt and deficit and who is best placed to manage the economy. Is health spending going to remain as high as it has been, given all those factors that you just listed, given that we're now out of the emergency phase of the pandemic?
What we spent the money on is on COVID and managing the pandemic, not on the sort of structural issues in terms of making sure we have a health system that is actually able to manage. And we already knew that we've had an overstretched health system, both in terms of hospital and the community or private and primary health care system. Now, we've got this problem now because now we're facing a situation which, as I said, we're going to have to face with ongoing COVID threat. We're going to be facing this long COVID, and we're also having to catch up on the debt, which is really the fact that we've got surgery which has been delayed, and also care which has been delayed, and diagnoses which have been delayed. So people are really, getting later diagnosis and requiring more significant treatment because things are being held off. Now, this is a real problem, and I think the thing that the AMA would like to point out is that we really need to recognise this, and neither party recognise this. And look, if we had a bushfire and we were left with this legacy and with so many people left in a fair bit of trouble in terms of the health and left behind, and also with this ongoing threat, we'd be applying a sort of a post-disaster recovery type mentality. And that is what we need to have at this moment in time. Understand that it's no point us having got through so many people through COVID, only to have them continue to suffer or potentially die early because the health system is unable to manage these extra new layers that are going to be required to care for the new burdens caused by ongoing COVID, long COVID, delayed care, and also continuing to provide health services on an ongoing basis for everything else.
Are doctors like you hearing what you'd like to hear from the campaign trail about those plans for future spending and strategies to manage COVID in the community?
Not at all, I'm afraid, and we've heard basically nothing from the government, unfortunately. They throw out large numbers, but they're essentially recurrent spending or spending they spent on COVID to, do the things we need to buy vaccines and do the testing. I mean, that's what that was spent on. That was not on the ongoing health needs of the community and the new layers of care that are going to be required. So we really do need, number one, a post-disaster recovery mentality in terms of catching up on things like elective surgery. And the Victorian government have, to their credit, focused on that. Areas like looking at delayed care, looking at long COVID, but also just really bulking up both the hospital system and the primary health system for ongoing needs to be able to look after COVID in the long term. Because I think at the moment, as we've kind of said, we're almost at a stalemate at the moment. We could even get worse at some stage with COVID. We need to understand this will be on top of the healthcare needs that we've had to provide for everything else.
Dr. Chris Moy, thank you.
It's a pleasure.
So it's pretty clear the government's fiscal strategy has had to change considerably because of the pandemic, and the nation's finances don't sit where many had expected just a couple of years ago. Peter Martin is the business and economy editor of The Conversation and a visiting fellow at the Crawford School of Public Policy. He joins us now. Peter Martin, thanks for joining us. This whole pandemic has led to a bit of an economic experiment. How worried should we be about the state of national debt and budget deficit right now?
Not at all, Jeremy, because the alternative would have been worse. The same as during the global financial crisis, when during the election, the coalition's reminding us that Labor ran up lots of debt. Nowhere near as much, of course, but then the crisis wasn't nearly as bad. That meant that Australia was, well, about the only country in the developed world to avoid what is called, in the rest of the developed world, the Great Recession. We here call it the GFC, or the global financial crisis. That's because the government borrowed big to spend on cash payments to households, in its case, to spend on building school halls. Here the government has borrowed much bigger crisis, but same advice, acting on the same advice, and it has saved, well, thousands of deaths. In most countries in the world, in the first year of the COVID crisis, deaths went up, and deaths went up more than COVID. In other words, there were deaths caused by people not being able to get to hospital and not being able to get a place for other conditions. Here in Australia, deaths went down, including the 800 or so people who died of COVID in the first year. That's because we adopted masks early. It's because we locked down, and we, as a result, had a mild flu season. So the benefit to Australia, and of course we kept Australians in jobs through JobKeeper, an idea we borrowed from New Zealand, that we kept them tied to their employer. It cost a lot of money, but the alternative would have been worse.
And yet we keep hearing from the election campaign trail that there is now this need to rein in spending now that the emergency phase of the pandemic is over, that the state of national debt poses a risk to future generations, our future capacity to deal with other issues that may arise. What do you think of that when you hear that from all the major parties?
It's not literally true. You know, people say, think about the children, or think about your grandchildren. How are they going to have to pay off the debt? A few points to make. One, debt doesn't need to be paid off, ever. The government is more like a corporation than it is an individual. An individual who borrows needs to pay, or when they die, it needs to be paid out of their estate. A company, BHP, lives forever. So does the government. It borrows, repays. Australian government loans are being repaid all the time. No problem there. They're just borrowing more money to substitute. There's no end date. So there's that. As for the cost of the repayments, our children and our grandchildren will be, according to the intergenerational report, in 40 years' time, 70% better off, 70% higher GDP per person. Now, if that's the case, how can I put this? Could they afford an extra 2% of their much higher income in tax? Of course they could. And there's something else specific to this bout of spending. It wasn't the case in the GFC. The spending was financed by government borrowing. They issue bonds, which is a piece of paper basically in return for money. Those bonds, those pieces of paper were bought by the Reserve Bank. Of the extra bonds issued during the global pandemic, around 60% of them, depends on the line of bonds, depends on how many years, are actually owned by the Reserve Bank. This means, yeah, sure, the government's got to pay more interest. Doesn't at the moment. Interest is no higher than it was because interest rates have been low. In due course, it'll have to pay more interest because it's borrowed more. Who will it pay it to? The Reserve Bank. What will the Reserve Bank do with it? Do with, say, half of it? It'll hand it to the government in higher dividends. It's a wonderfully circular thing. Usually you can't do this because usually your currency might tank. But given that every other currency, every other country, the US, Europe, so on, has been doing this, there's no currency for us to depreciate against. They're all doing it. So, you know, unless we judge ourselves by the standards of another planet and so we'd depreciate against somewhere else that hadn't been doing this, we have no problem.
We've just been hearing from the AMA about the need to not take the foot off the pedal when it comes to health spending, with all these other health issues kind of coming down the line as we start to get back to some semblance of normality. Where do you see health spending going in the next few years?
Going up, and that's because we want it to. The Australian National University that I'm part of runs a pre-election survey. Every election, they've been doing it for about more than 20 years. And it used to be that you asked people what are the most important issues to them, and number one was tax. They wanted lower taxes. Health spending was quite low. Now, sometime in the 2000s, that changed. The two lines crossed. And now health spending is the number one thing that people want. They don't want less of it, they want more of it. That's because the population is older, more concerned about that. And also the population is richer. And when you get richer, you feel less need to have your tax cut. And you move on from primary needs, you know, getting fed, housing and so on, to secondary needs, which are education for your children and being looked after. The one thing really that private money can't buy.
Peter, thank you so much for your time on the program. Really appreciate it. And that is the show for this week. Thanks for your company. From all of us, bye for now.